Have you ever felt a sharp pain in your back or side that seemed to come out of nowhere? It might not be muscle strain, it could be kidney stones. It's a condition that can be incredibly painful and disruptive. But the good news is, there's a lot we can do to understand and prevent them. So, if you've ever wondered what causes these tiny but mighty troublemakers, or how you can naturally reduce your risk, you've come to the right place. Let's get into it. First off, what exactly are kidney stones? Imagine tiny, hard crystals forming inside your kidneys. These stones are made from minerals and salts that your body normally flushes out through urine. When these substances become too concentrated, they can crystallize and stick together, forming a stone. They can be as small as a grain of sand or, in rare cases, as large as a golf ball. It's when they try to pass through the urinary tract that the real trouble begins. So, what leads to these stones forming in the first place? The number one cause, and I can't stress this enough, is not drinking enough water. Dehydration is the biggest culprit. When you're dehydrated, your urine becomes more concentrated, which is like creating the perfect environment for these minerals and salts to crystallize. Think of it like making rock candy. You need a supersaturated sugar solution. In this case, your urine becomes a supersaturated mineral solution. So, the single most important preventive measure is staying well hydrated. We'll talk more about how much water you should be drinking later on. Diet also plays a huge role. Certain foods can increase your risk, especially those high in oxalates. Oxalate is a compound found in many healthy plant foods like spinach, rhubarb, beets, nuts, and even dark chocolate. When oxalate combines with calcium in the urine, it can form calcium oxalate stones, which are the most common type. Now, this doesn't mean you should avoid these healthy foods entirely. It's all about balance and moderation. We'll discuss how to manage this in our prevention section. Another dietary factor is a high intake of sodium, or salt. A high salt diet can increase the amount of calcium your kidneys have to filter, which raises the risk of stone formation. This isn't just about the salt shaker on your table. A lot of sodium is hidden in processed foods, canned soups, and fast food. Similarly, a diet high in animal protein, think red meat, poultry, and eggs, can increase uric acid levels in your body, leading to another type of stone called uric acid stones. Genetics can also be a factor. If you have a family history of kidney stones, your own risk is higher. Certain medical conditions like urinary tract infections, gout, or hyperparathyroidism can also predispose you to developing them. Even your geography can play a part. People living in hot, dry climates, often called the stone belt, are more prone to dehydration and therefore kidney stones. Now, let's talk about the symptoms. How do you know if you have a kidney stone? For many people, a small stone can pass without any symptoms at all. You might not even know you had one. The problems start when the stone is large enough to cause a blockage or get stuck while trying to pass through the ureter, which is the narrow tube connecting the kidney to the bladder. The most classic symptom is a severe, sharp pain, often described as one of the most intense pains a person can experience. This pain typically starts in your side or back, just below the ribs, and can radiate down to your lower abdomen and groin. The pain often comes in waves, fluctuating in intensity as the stone moves. It's not a dull ache. It's a very distinct cramping pain. You might also notice changes in your urination. This can include a persistent need to urinate, urinating more often than usual, or urinating in small amounts. You might feel a burning sensation when you urinate, similar to a UTI. The urine itself might look different. It could be cloudy, have a strong, unpleasant smell, or be pink, red, or brown, which is a sign of blood in the urine. Nausea and vomiting are also very common, often accompanying the intense pain. Some people might even experience fever and chills, which could indicate an infection, and that's a sign to seek medical attention immediately. If you suspect you have a kidney stone, especially with severe pain, fever, or difficulty passing urine, it's crucial to see a doctor. They can diagnose it properly and recommend the right course of action. Okay, so we know what they are and what causes them. Let's move on to the most empowering part: Natural prevention. How can we actively work to keep our kidneys healthy and stone-free? As we mentioned earlier, hydration is king. The goal is to drink enough water to keep your urine light yellow or clear. For most people, this means about 8 to 12 glasses, or 2 to 3 liters, per day. If you exercise a lot or live in a hot climate, you'll need even more. Keeping a water bottle with you at all times is a great way to remind yourself to sip throughout the day. Let's revisit diet. For managing oxalates, it's not about elimination, but about smart pairing. If you're having an oxalate-rich food like spinach, try pairing it with a calcium-rich food like cheese or yogurt in the same meal. The calcium and oxalate are more likely to bind together in your stomach and intestines rather than in your kidneys, and then they'll be eliminated from your body without causing trouble. It's a simple but effective trick. Cutting back on sodium is another big one. Aim for less than 2,300 milligrams of sodium per day. That's about 1 teaspoon of salt. Start reading food labels and choose low-sodium options whenever possible. Cooking more meals at home gives you full control over how much salt goes into your food. Use herbs, spices, and lemon juice to add flavor instead of relying on salt. Your kidneys and your heart will thank you. When it comes to protein, it's about moderation, especially with animal protein. Try incorporating more plant-based protein sources into your diet, like beans, lentils, and tofu. This can help lower the levels of uric acid in your urine. Now for a wonderfully refreshing tip. Add lemon to your water. Lemons are rich in citrate, a natural inhibitor of calcium oxalate stone formation. Citrate binds with calcium in the urine, preventing the formation of crystals. Squeezing fresh lemon or lime juice into your water not only makes it more flavorful, encouraging you to drink more, but it also provides this powerful protective benefit. A little bit of lemon juice each day can go a long way. Finally, maintaining a healthy weight through a balanced diet and regular exercise is beneficial for overall kidney health and can help reduce your risk. It's all interconnected. A healthy lifestyle supports all of your body's systems, including your kidney's ability to filter waste efficiently. To recap, the cornerstones of kidney stone prevention are simple yet powerful. Stay hydrated above all else. Be mindful of your diet by managing oxalate intake smartly, reducing sodium, and moderating animal protein. And embrace the power of citrate from lemons and limes. These natural, everyday habits can make a world of difference in keeping your urinary system happy and healthy. Remember, this information is for educational purposes and shouldn't replace professional medical advice. If you have concerns about kidney stones or are experiencing symptoms, please consult with your healthcare provider. They can give you personalized advice based on your specific health needs. Thank you so much for watching today. I hope you found this information helpful and empowering. If you did, please give this video a thumbs up, and don't forget to subscribe to our channel for more content on living a healthier life. Hit that notification bell so you won't miss our next video. We love hearing from you, so drop a comment below with any questions or topics you'd like us to cover. Stay healthy, stay hydrated, and we'll see you in the next one.